launching in Texas. So we are thrilled to be part of this panel, and thank you so much for having us.
Awesome. Thank you so much for that. I'm going to pass the torch to Jill.
Awesome. Yeah, my name is Jill Barrientos from the Dominican Republic. I moved to New York from DR in 2009 and spent the next 14 years in the convergence of healthcare, navigating healthcare for the minority communities like Hispanic and technology as well. And because of that, I founded Domi. We are a tech-enabled, hyper-personalized social wellness and care application where Latinos can actually join, build communities in a localized way, and then connect with digital and non-digital healthcare services at the same time. Thank you so much for having me here. Super excited.
Oh, I love your excitement. It's making me even more excited. I appreciate that. I'm going to pass it on over to Danielle now. So I can't even talk right now. I'm all over the place. I'm passing it on to Danielle, putting myself on mute.
Thank you, Alexis. Thank you for the invitation. I've been a fan from afar of Tequeria for many, many years. And so happy to be here among other Latinos that are interested in utilizing technology to make things better for our communities. I'm the co-founder and president of Salud con Tech, which is a ecosystem building familia community to help increase the number of Latino founders, Latino VCs, and Latinos really making changes in the digital health space. I'm also the executive director of the Latino Coalition Against COVID-19, where we're a movement working to increase Latino representation in all parts that have to do with health equity in the United States. And happy to be here. Looking forward to the conversation.
Thank you, Danielle. Sorry, I'm just reading in the comments from Oscar. He said, "So you mean we moved past Vapuru and Spray?" No, not. We're just adding things, right?
Right, here's everything.
Yeah. Lastly, I'm going to let Luz talk a little bit about herself. So I'm going to go back on mute.
Hi, everyone. I'm super excited to be here. Thank you for the invitation. My name is Luz Gomez Cáceres, and I am from Colombia. I have been here in the US for 23 years, and I am a licensed clinical social worker. I have been in the field for about 25 years, I think. And it is very important for me to advocate for access to mental health services for the Hispanic community. I feel that our community really struggles because we do not have enough clinical social workers or therapists that speak the language and also understand the culture. So I'm super happy to be here, and I hope that we can spread the word about mental health and to also spread hope that we can access services in our language and in our culture. And I'm super anxious and nervous to be here. I'm a clinician, so I'm not really good with any of this.
Don't be nervous. You're doing great so far. So no nerves. It's just a whole bunch of individuals from the Latinx community talking about good stuff. So no nerves. We're all good here, and we're all very supportive. Thank you all so much for your introductions. I really appreciate it. And so I wanted to start off by saying this session is called Color Esperanza, based off a song by Diego Torres. It's a very, very old song, but it came back during the pandemic. And it's mainly about a song about unity and about hope and just in general. So I thought that this was a really great title for this session because that's what, at the end of the day, what Latinx and tech are here to do, right? To provide hope and strength and resilience and keep pushing through obstacles and just really making it a great, using health tech especially to better ourselves, and not just to better ourselves, but to better other communities as well, right? Because at the end of the day, like, if we win, everyone wins. And that's just how I feel personally. If anyone else feels different, sorry. But yeah, so with that being said, I wanted to just really dive right into it. The first question, well, it's not really a question. No, it is. So I'd like to know about each of your personal experiences in being affected by health disparities, especially within the Latinx community. So we're actually going to start off with Marisa for that.
Yeah, thank you. I mean, this is a question I love answering and love asking people, because everyone has such a unique story, especially when it comes to healthcare. And I think my story is really rooted in the experience of accessing care. I think if you think about how we've built a U.S. healthcare system that isn't designed around the unique needs of our communities, access rises to the top of the experience and issues that we all have. And so as a young child, I remember from my grandparents who immigrated to the United States, having to navigate the U.S. healthcare system, having to apply for Medicaid. This was when the Medicare program came out, the dual eligible program. It was incredibly confusing for them as people who were not native to the country, who couldn't speak the language, and certainly could not fill out the forms. So as a young child, those are my earliest memories of really understanding a system that wasn't designed for everybody and having to really help navigate that. And that inspired me from a policy perspective of learning about what does Medicaid even mean? What are we trying to do? And really crafting my career around how do we change policy to really improve access? And how do we think about that experience from a patient perspective to make it more user-friendly? And I think in the world we're in today, we expect instant gratification, one-click access, and we haven't translated that over to healthcare. And so 20 years later, we have that same experience, and we continue to miss out on these populations that need the service, but they can't access it. And we've made it so hard to access and so confusing. And so a large part of my passion and my focus has been around how do we innovate around that experience of access? How do we make it easier? How do we make it more consumer friendly? How do we use words that people actually understand? And so I think disparities goes a broad range of topics, but for me, access has always been an area of passion for me, and an area that I am determined to change for my community. That was certainly inspired at the very beginning of my childhood with my family.
Thank you so much for that. Yeah, I'm sure we all know, especially within our community, there's a lot of underserved and underrepresented areas, and people with healthy communities obviously have more health access, right? And people without that don't have that. So thank you so much for that. I'm going to pass the same question and pass the same question of, what your personal experience is in being affected by health disparities within the Latinx community. We will pass that on to Luz. Surprise! Also, you're on mute.
I'm back. Hi. I think I have a very similar experience than Maritza in terms of not just with my family, like my parents, they're close to being 80 in their 80s, and they don't speak any English. They came here as an immigrants as well. So for them, it has been very confusing to connect with providers. It has been very difficult for them to access providers that understand them from their culture and also their age, and how it is to be an elderly person in the Hispanic community, and how we connect with them, how we care for them. It has been difficult to see my mom sometimes being very upset because she is not understood, because she doesn't feel supported sometimes. And some of their friends experience the same or very similar things when they try to access care. Also, as a clinician working with Hispanic patients as well, the fear that they have to access care if their immigration status is not legal is a lot of fear, a lot of misunderstanding about the process of living our countries to come here for in search of a better health, and to be able to connect with someone who has the compassion to understand that process of leaving people that they love, that we love behind. So I think that has been personally and professionally my experience with disparities in the healthcare system.
Yeah, you're absolutely right. Those bilingual barriers have been tough for a lot of individuals. I also can relate where I do take care of a lot of my grandfather's medical things going on. And he also gets like the letters in English, and then he calls me and he's like, "Can you translate?" And he actually called me like 5 minutes ago, and I'm like, "Grandpa, like, I'm working right now. Let me call you back." So I totally get it. It's definitely a big barrier, and I'm really looking forward to hearing how CVS Health is going to be changing that up. So now we're going to transition. Same question to Daniel. You're also on mute.
Happens to the best of us. I'll get into the importance of digital literacy later, but digital skills are obviously very important. But my story, takes place in Oakland. So I'm the baby of 5. We were all born in East Oakland, California. Grew up on WIC program, if anybody's familiar with that program. And one of the problems that our family faced was access, just like I think that's going to be a common theme during our discussion today, and access and language barriers. And so when my mother first arrived here, her English was not the greatest, and so she had difficulty communicating her problems to physicians. And also, with studies that back it up, physicians can be biased towards patients that don't speak English as their native language. And so she felt that she was receiving subpar care, and I wish I was a doctor at that point, because then I could have looked into it and then said, you actually are receiving subpar care, and something needs to be done about it. And so my dad was, he was born here, Mexican, but he was born here. He's a little tech savvy, definitely. And so he figured out that certain hospitals, like the nice ones, if you just showed up pregnant, they will deliver your baby there. And so that's how we upgraded from Alameda County Hospital to Kaiser, where we just, arrived in the emergency department. And that's where I was born, in Oakland Kaiser. But it shouldn't have to take something like that. It should be, everyone should have access to the best care available to them that's nearby them, with providers that speak their language, and if not, interpreters. And so my mother's experiencing healthcare in the United States is what led her to eventually become a Spanish interpreter. And so, because she had felt so much difficulty and feeling neglected because of language barriers, she decided to be a bridge for others to be able to communicate with their physicians.
That's amazing.
I love that. Shout out to your mom, because that is so cool.
Right?
That she went.
Mama,
yeah.
Shout out.
Right. Shout out to mom, because that was just, exactly. Sound about that. Exactly. That was a powerful story. I agree. And yeah, the common theme of access. And I agree. You shouldn't have to walk into a, hospital pregnant, about to deliver a baby just to be accepted in. Like, that's super foul as is. So yeah, definitely getting forth with that access is super important. And now lastly, I'm going to pass the torch to Jill. Same question.
Yeah, it's a bit different, because I was born and raised in DR, and it was, if you think about it, it's like a play where you have like act 1, 2, and 3. And the first act 1 is like my father was the OBGYN, and the experience of healthcare was picking up the phone and calling a colleague and just showing up. There was no insurance, no fear, no hesitation. And then I moved here in 2009. And I'm like, what is going on here? What's happening? Why can I connect to someone? And I actually went to apply for Medicaid. The first thing I did, like the first couple of months. And right there, I met the manager. He's like, why don't you come work with us? You speak like perfect English, you speak Spanish, you have super personality. Started working in a field that I had no clue what it was about. But then that exposed me to work in a region here called Long Island City in Queens, where it's the most diverse borough in New York City. So I was the one helping all the migrants, basically, that came from Egypt, from Latin America, to apply and navigate healthcare, because it doesn't end when you actually get your card from the insurance. It's what happens after that, the navigation of like, where do I go? When do I go to a primary care doctor? Like, why do I have to go to the primary care to see my dermatologist? I'm like, why can't I just go to my cardiologist? I have the phone number right here. So all these things that then I ultimately had to navigate with them and for them, gave me like a direct perspective into how, at the end of the day, acculturation, like the fact that you have to kind of like change yourself and adopt the dominant culture. And that means your well-being. That means the things you eat. And in our neighborhoods, you have access to the bad things to eat. So that all trickles down to our multi-generational families. So that's like Act 1. Act 2, going to the Affordable Care Act, working that journey with health systems and the patients. And then Act 3, during COVID, I was home now day to day. And I heard my mother just trying to book a taxi so they can take her to the appointment. And she had to basically do the whole journey. So call the insurance to get the approval, call the companies that manage the taxi companies to confirm, and then call the taxi companies to book her own appointment for that one way. And if anything breaks, an authorization is not registered, the taxi company says, nobody called me. No, that she has to go all the way back. And that is only one process of booking one appointment, one tax, not even the doctors. So to me, it was like mesmerized, like dumbfounded. Like, I cannot believe that people, and this is me with tons of years of experience in healthcare. I can only imagine people that don't have any way to connect with someone that can kind of like remove those blockers for them. They just give up. They just, you know what, I'm fine. I'm not that bad. And then end up in the ER or chronic conditions that could have been avoided. So I just was exposed to so many different perspectives from like families that had to go to their homes, and seeing like the difference between what happens back with our culture, with our people, and the difference and the dissonance when you come here and you don't have that really. So that's one of my multi-level experience, I guess, in this in this industry.
Thank you so much for that, Jill. That makes complete sense. And I love the perspective on having you born in DR and having almost that culture shock of like, what the hell is the USA doing and what's actually going on? So hearing that point of view, I feel like was very important for our audience to definitely know and understand. So going forward, the next question that I'm going to ask is, do you believe digital innovation can truly reduce healthcare inequalities? Obviously, we're all on here for a reason, so the answer is going to be yes. But if you can elaborate on why you believe this, that would be great. We'll start off with Daniel this time. On mute again.
I have to do it every time. But I think if everyone who knows me knows what my answer to that question will be. And I feel that it will almost be impossible to really elevate the level of healthcare that we want without utilizing technology. If you look at how healthcare is delivered, how healthcare problems are solved, they take resources, right? It takes spending, funding, and utilize those resources in a way that focus on the population that needs it most. But if the funding is finite, if the amount of money that's coming into a community or to a neighborhood or to a hospital is limited, then you have to somehow use that limited amount of funding in a way that makes it more efficient. And that's where technology comes in. With technology, you can expand access to patients who didn't have it before, just by not just offering them something like telehealth visits, but then teaching them how to use telehealth. And now this device in their home, which is their cell phone that has internet access, now is access to the hospital, now is access to care, whereas before it was not, and they had to physically go to a clinic. I see technology. Are you all familiar with the Peruvian tumi? Right, it's a ancient Incan symbol, but it's a scalpel. Right, it's a clinical, surgical scalpel, and the meaning behind it is that which can harm or that which can kill can also be used to cure, right? And so it's sort of like the double-edged sword. But a knife can do bad things, and a scalpel can do amazing things. And I see technology in the same way. If not used appropriately, it can further expand gaps in care and make these disparities worse, such as moving everything online to telehealth, but not teaching the community how to use it. And so now, before they did have access to these in-person facilities, but now that all the resources moved to online and they don't have a way to get to the online resource, now they're even in a worse place than they were before. But if we do it in a way that's inclusive, that's community focused, that is based on making sure that the community is at the center of the design, then technology is something that I believe can be used for good and can make things better for both the patient and their surrounding community.
Thank you for that answer. I mean, does anyone else, I'm just curious to know, like, what are the audience's feelings on what Daniel just said? Please feel free to drop. Oh, there we go. Oh, yeah, I agree. The community should be at the center of design. You know, all these quotes coming out of this summit today are so near and dear to my heart, and I'm loving it because we've had, our keynote also had a really great quote, and I'm like writing it down and just going to be blasting these out so that everyone has like friendly reminders. But yeah, Oscar says, I think data exploitation is a common misuse, for example. Yep. Agreed. Definitely. So yeah, I wanted to ask the same exact question. Do you believe in digital innovation can truly reduce healthcare inequalities? I'm going to pass that to Marisa.
Yeah, I think, innovation, especially in healthcare, is incredibly exciting. And we're seeing so many amazing things come out of innovation at the clinical side, the patient side, the data side, the user experience side. But I think at the root of innovation, we have to remember that healthcare is personal, and healthcare is a human body, and healthcare is somebody's most vulnerable state. And if we don't continue to honor that and honor that experience, then, to Daniel's point, healthcare innovation and technology could be used in a way that leaves vulnerability and doesn't engage people when they need it the most. And so while healthcare has evolved and the experience is starting to get better and starting to focus on patient experience, I think we have to always come back to the root of why some of these inequalities happened in the first place. And that's because we didn't recognize people as patients, as humans that have unique needs that may not fit into an algorithm or may not fit into a widget that, is an app now on your phone. It's so important to always remember that at the end of that patient experience and that provider relationship is a human being. And as long as we continue to come back to those very core principles of healthcare and healthcare delivery and the trust that has to be there, then I think we can really look to innovation to improve efficiencies and improve access and improve experience. But it has to start with trust, and it has to start with the relationship. And I think at the core of every healthcare experience, if there is no trust, then we can innovate all day and it won't move the needle. And I think these conversations are so important for that, because we have to have leaders speaking up about the importance of trust, the importance of community, and the importance of the patient's needs. And then we innovate. And then we start to bring things to market that we know are meeting a specific need and are honoring the patient's need.
Thank you for that. Yeah, I mean, funny enough, that's going to actually lead into my next question, because you touched on a lot of different points. And I think this question would actually make the most sense of going in and transitioning. So I'm actually going to pass this off to Luz. COVID impacted a lot of different communities, including our own, the Latinx community, the Hispanic community, Black, Indigenous people of color community, like a whole bunch of different communities, right? We're all aware. But for the Latinx community and Hispanic community, how can we correct disparities before another huge health emergency?
I think what we're doing today actually is one of the ways that we can help our communities is to create awareness, to educate our community, to let them know about the resources that they have available. I'm talking as a social worker and as a therapist. One of the things that I noticed during COVID is that the Hispanic community did not access services. The level of stress, anxiety, fear, depression, a lot of people suffered unnecessarily because of the stigma related to, for instance, accessing mental health services. If we start educating our communities and getting that trust that they need in healthcare providers and mental health providers, I think hopefully we don't have to go through that again, but if for some reason it happens again, I'm hoping and I really hope that our community is going to feel less stressed about accessing and reaching out to people that can help them. During COVID, to me, it was very concerning to see the level of depression and anxiety that I observed with people, especially with the Hispanic Latin community. It was a lot of fear. It was a lot of questions that they didn't have answers to. And because they didn't have enough resources to get the information that they needed in the language that they wanted to, it was very difficult for them to overcome that fear and that depression and that anxiety. The lack of providers, again, going back to one of the things that I'm very passionate about, is to create awareness that we need providers that can understand our culture, especially when it comes to diagnosis. It's so easy to diagnose a Hispanic person with attachment disorders or emotional dependence disorder, when in reality it's part of our culture to be close to our family, to check in with our parents almost every week or every day, if possible, to understand who we are as a culture. So that way we can, if we're going to use a diagnosis, to be appropriate diagnosis for mental health, especially for mental health. So I hope, and again, that we don't go through anything like this. But if for some reason it happens, that our community feel more confident and understood of the emotions that they go through with something that can be so scary as a pandemic.
Thank you for that. Yeah, I see a lot of people agreeing with what you're saying in the comments, and it's you're absolutely right. And again, hitting back to that access nature, like that's basically the core of this conversation, is just receiving that access. So I'm gonna actually the same question. I'm gonna give that to Daniel, and then we're gonna move on to our another question.
Sure. If you look at undocumented immigrants in this country, half of undocumented Latinos lack access to healthcare, lack health insurance, which is what you need to have a consistent access to healthcare. I often ask others the exact question that you're asking me right now, which is, if a pandemic was to come right now, would Latinos be once again disproportionately affected? Or have we put in place the things that need to be put in place in order to prevent that from happening? I would say the answer to that question is we have not put the things into place. Healthcare system has failed Latinos historically, and there's a lot of work to be done. I think we can get to a place to where if a pandemic was to return, Latinos would not be disproportionately affected. But there's certain things that still need to happen. Certain policies need to be changed. We need to reconnect the community, because as we all see, that when a pandemic strikes, stay-at-home orders come next. And if you're not equipped with the skills to continue your daily life from home, then you're disconnected. You no longer have those resources that Luz was talking about. You're not able to, I couldn't get my mom on a Zoom call when the pandemic started. And I didn't really think about those skills until the pandemic happened, like most people did. But you can be sure that she can use Zoom now, right? But I made that happen with my family, and that's what we need to do. We need to look at our communities like our families and make sure that they have what they need right now, and they make sure that they have what they may need if things were to turn into a pandemic once again. And if you ask me, I think it's only a matter of time. I mean, we all know that pandemics come and go, and no one can predict when the next one will happen. But one thing is for certain, it will come again, right? And I don't want to be in a situation where I'm seeing what I saw when the pandemic first started, which was Latinos on Latinos upon Latinos in the ICU. I don't want to see that. You know, that was painful to watch and painful to experience, but even more painful for the families of these patients. And so I think it's really a call to action, your question, which is, what can we do to make sure it doesn't happen? And I think a lot of the other amazing speakers today are addressing some of those things. You know, get out the vote. The Latino vote matters. you know, come together as a community, because el pueblo unido jamás será vencido, right? And there's power in numbers. And so that's my answer to the question. I'm not sure if I answered the question or if I gave instead more questions, but I think we're not there yet, but we can be.
No, that was perfect. We love more questions too, right? It just keeps the conversation going. So that was really powerful, and that actually does lead into another transition of a question, which is basically, what are we doing, right? So this is going to be, I'm going to pass this question on to Jill. What are you currently doing to inspire trust within the community, with all the pre-existing barriers already existing? Yeah, let us know what you're doing.
I think that, in general, if you want change to be made, we have to make it ourselves ultimately. We know there's a lack of representation at the policy level, but also even at these large institutions have the funds to come up with these amazing solutions, and they don't have our perspective at the core or the center of their decision making, what to innovate, where to invest, and how to approach our population beyond translating a website. So it's kind of like a call to action. This is Tequeria. So a lot of people want to find jobs in like these fun, exciting Web3 crypto industries. You can bring all that stuff also to healthcare at some point, but I will call everyone here to like find your place within the healthcare space. Be, as a technologist, whichever one you need, we need you to make these changes, and we need representation at every level. And that's kind of like where most of us, were pushed to here. Like for me, it's too slow. This is happening at a very slow pace. The industry itself is too slow to innovate. There's other things that we can learn from other industries that we can bring in. And seeing COVID, how all of a sudden all these barriers and all these buts and all these obstacles were like, now we have to be forced to accelerate and forced to actually get things done. So it makes me wonder, like, what else is there today that we're using the same excuses to not get it done, and then we have to wait for another, pandemic to happen, another like tragedy to happen. So for me, it was that drove me to kind of like build this community where people can actually come in and yes, complain about healthcare, yes, share our remedies, because sometimes we don't have to medicate all the time for everything, and sometimes that happens here because we have minority groups, because they don't trust us, because they don't believe what we're saying, whether it hurts a lot or not. So to me, it was more about building a place where our Hispanic and Latino families can come in. And the same thing that is happening today in WhatsApp, that's happening today in a hair salon, that's happening today at the Domino's tables, can actually happen in a digital environment. That now it doesn't matter where you are, or it doesn't matter like where you move, because we're in a remote world. You can actually now reconvene with your community and ask those hard questions, get the answers anytime you need to. And that's, to me, was very important. Build a community in a digital way first, and that's what Dr. Me it's about. Gain their trust. Back to Marissa's point, if you don't change the mindset of the user, for instance, they're not patients yet. They're just users in some application that you built for them, some interaction, or this Instagram, wherever it is. But if you're not working to change that mindset of how we approach healthcare as an afterthought, as in, if I'm not almost dying, I'm not gonna go to the ER, and you address the things on a day-to-day habits, like, am I eating correctly? Am I going to the gym? Am I staying active? Am I paying attention to how this is impacting my Latino community, and get an active voice in that? We don't do that first. Whenever we introduce a doctor, even if they speak Spanish, they're not going to go and access it, because they're not going to think it's needed until like they see themselves into like a very critical condition. And this trickles down to our mortal, like our families. Like we have a tia lives with us, the cousin that moving because they're going to college, our parents live with us. And that one person that's making all the decisions, if we don't change that mindset, that's going to trickle down to everybody else. And the kids are going to grow with the exact same mentality, and it's going to transcend over generations. So for me, it's what's important to build that community, build that trust internally, and then understand where everyone is in their journey, whether it is, I'm not even ready to get healthcare, but get them to a point that when they are ready to access healthcare, we have already identified the right community health centers that they can go to, that we know are going to take their best interest at heart, because we already vet them, we know them. So that's kind of like where we're working on that space. That's what we're trying to do at Dog Dome. It's a hard job, but it has to be done. And nobody can make it like us Latinos at the same time.
Period. I'm gonna do some snaps on that because that's
We got
absolutely true. Yeah, I'm gonna
get a table, or we have to build our own table. It's either or.
right. So basically, we gotta get it done at the end of the day, and that's why this discussion is so important to have. And I saw some comments that people are really like they don't realize how passionate they actually were about this, which is really amazing. That's why we're thinking, yeah, we're trying to present different things and really dive deep into these topics that aren't discussed as much as like how Jill mentioned, like Web3 or crypto or whatever else, right? There's a lot of other important topics, especially within the health tech industry, to discuss and to not just discuss, but to find solutions. The same question, I'm going to pass it on to Marisa. The same exact question, like how are you building trust within the community? What are you doing to get past all the barriers created? And it's going to be the same also for the rest of the panelists, but we'll start with Marisa.
Yeah, I think, the pandemic highlighted a lot of things for us with the healthcare system. But one of the things that we're most passionate about is that the Latino community hasn't access to primary care or isn't accessing primary care in the way it's intended and the way that would really keep our community healthy and thriving. And when the pandemic happened, accessing a primary care provider became so difficult. It was difficult before and put a pandemic in that place. And now you're waiting 3, 4, maybe even 5 weeks to get a primary care appointment. And as we kind of tear that apart, there's a lot of layers to that. But a key piece of that is that patients don't know how to access primary care. They don't know why they should access primary care, and they don't have established relationships with providers that they can go to when they have a need. So they are trying to get urgent care, they're trying to go to the ER, they're trying to access telehealth solutions. But at the core of it is, how do I build a relationship with a provider that knows me, that knows my family, that knows my needs, and that I can talk to in between visits? Maybe I don't even have a need, but I want to know somebody cares about me, and I want to know somebody is looking out for my health and wellness. And that's what primary care is designed to do. It's designed to treat when you need it, but also designed to prevent things from happening. And so many people within our communities don't have that relationship. So Zocalo Health is super focused on how do we build that relationship back with our community, connecting them back to primary care and building that trust. And to go back to some of our earlier comments, there's a lot of innovation that could happen to do that. But at the core of what we're doing is building those relationships. So we utilize community health workers to be in the community, to have those relationships, to have those discussions, and to start to just talk to people about their needs, and then provide some education around primary care. And that's, we say the word education, but that's just having a conversation. It's talking to people. It's taking away some of those medical jargon words we see in marketing and some of the words we're using here today as panelists. It's taking those words away and just having a real conversation with somebody that says, you're maybe a call to action for us in this relationship is to connect you to a provider that speaks your language and could be there for you when you need it. And so reintroducing primary care to our community, reintroducing the need for a relationship with a provider is extremely important to us, because once that relationship is there, then we can start to build in prevention. Then we can start to build in public health and population health interventions. There's a lot that can happen after that relationship is fostered, but it starts with educating, having the conversation, taking the stigma out, and making sure that our community is connected to a system that they can access when they need it.
Thank you for that. I agree. And there's actually questions a little bit kind of diving in from the audience, which everyone in the audience, I do see your questions. I'm not just ignoring you, I promise. We will get around to the questions. I'm just trying to let everyone, the rest of the panel, get through this last question. But yeah, we'll definitely touch back on what you just said, Marisa, because there's a couple people curious about, well, what about communities that don't actually have the access to technology? So we'll get back to that. But for right now, let's just continue focusing on the building trust question. I'm going to pass it on to Luz. So Luz, you can go ahead, and then Daniel, you can take it away right after her.
Hi. I agree with what have been said so far, that we need to, again, I think about my work from the social work perspective and from the mental health perspective. So to me, working against the stigma about mental health issues Last month was Suicide Prevention Month. I don't know if you guys were aware of that. And suicide is the second leading cause of death in individuals, Hispanic, between the ages of 15 and 34. So that's huge. And one of the things that happens is that we don't talk about it. In our culture, there's so much stigma about mental health that I think part of what I see in my role and us working in the field is to really start a conversation, really start having open, non-judgmental conversation with our patients, with our neighbors, with our friends who are part of our culture. Advocacy is a huge thing that we can do to develop that trust, to open that open conversation, to really help people understand the importance of reaching out for help. Again, I'm thinking as a social worker, and that's what I focus on. Helping people understand how important it is to take care of our physical health the same way that we take care of our mental health, and vice versa, is equally important. So I think that is part of what we can do, and I believe that if anything happens with COVID that was helpful for us in the field of mental health is that it really opened up opportunities for us to have dialogues, to start talking about mental health. I think, and I see this in the private practice, is that people are more open to talk about mental health and to talk about their struggles with mental health. So two roles that I see are very important is developing trust by doing advocacy, and but also by us representing our culture and who we are in terms of mental health and of course physical health. I don't know if that answered the question, but that's how I feel.
No, that was perfect. That does answer the question. You're doing great. You're doing great. No, seriously. There was a comment in there too. Yeah, from Julian, building those relationships should definitely include respecting and actively listening. Yeah, I mean, I agree with that. And also going back to what you said about the statistic about the mental health thing, like that's actually really wild. I didn't know that it was between the ages of 15 and 34. Like that is very scary considering that I'm 29 years old myself, and that it's like one of the leading causes. And it's very scary out there, more than I anticipated it to be. So yeah, I'm going to actually pass it back to Daniel.
Before you pass it on, I'm sorry. I just want to add that what is scary is that we don't talk about it. And I think that's what is the most scary thing, that we don't talk about it. There's so much stigma about it, mental health and suicide. So this is, I think, is so important for us to do this, to start having that conversation that is open, that is not judgmental, and it removes the stigma about mental health and suicide, for instance.
Yeah, no, I appreciate that. And you're absolutely right. Like I've, now that you say that, like I realize I am scared in a way. Like I said, I was scared because it's really not a big, thank God over the last couple years, like mental health has been more of a topic. But growing up personally in a Latinx household, it's like, no, 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 está bien. Like you're just overthinking, whatever. Like it's just,
No te loca, no soy loca.
yeah, right. And it's like, no, like I'm actually serious. Like there's some issues going on. But it was kind of told to like, don't ask, don't tell, don't talk about it. So I'm really glad that you said that actually, because it does make sense of why I said like, oh, like I'm actually like more scared than I anticipated. But no, I appreciate you saying that comment. Now we're gonna pass it on to Daniel too, just to finish off answering this question. Thank you, Luz.
Yeah, I would say the secret to building trust is loose. Promotores, right? People from the community who are able to communicate in a way that is native to who they are and is a reflection of who they are, because we know that when community members are interacting with promotores, they're more likely to share stories and they're more likely to tell the truth. Not to say that patients lie, right? But as Luz was pointing out, it's not easy to say, I have depression, I have anxiety, but you're much more less likely to share that private information with someone that you don't trust. And it's natural to have distrust in people who don't talk like you, don't dress like you, don't walk like you, don't eat the same food as you. And so if you can connect people with trusted messengers, which are the promotores, then you're much more likely to build trust with someone like that. And so I think that's a huge part in building trust, is how do we increase the number of promotores that are actively working in Latino communities. Also, who are designing the interventions to build trust, right? Because we have a lot of people working on building trust. If you Google that, you're going to see a lot of articles. And I would argue that the best people to design the interventions to build trust, if we're thinking about building trust in the Latino community, and those would be Latinos, right? So we need to get Latinos into leadership positions at all kinds of startups, right? Not just digital health startups. We need them as founders and CEOs, and at the table for housing startups, for startups related to improving digital access, to NFTs. I'm not sure how NFTs will help, but we need Latinos everywhere, because that's the only way, and that's what we're realizing now, is that opportunity for building trust is in community, and building community is through partnerships. And by connecting with one another, we can build partnerships, help build that community, recognize each other, and support each other. And that's where I feel trust can be embedded into the design, is by making sure that those with lived experiences are the ones leading the show. Those with disabilities are the ones creating the interventions for the disabled. Right? It wouldn't make sense for a whole design team without a single person who's disabled to be creating all of the programs for disabled people, right? It's just going to be much more powerful and much more useful and much more likely to succeed if you have somebody from that community that's part of that program. And so I would just say that, we just had our health equity fiesta here in Los Angeles, the Latino Coalition Against COVID-19, where we partnered with Dia de la Mujer Latina, which is one of the largest promotores organizations in the country. And one of the things that we did that was different from other health fairs was that we incorporated a social determinant of health screening program, right? Because most health fairs you go to, they'll check your blood pressure, they'll check your sugar to see if you have diabetes, and then they'll say you have these problems, and then they'll leave. Whereas our program, we also screen for, do you have housing, right? Screening questions for depression and anxiety. Do you have access to a computer, and are you able to get information that you need easily? And then if you weren't able to get any of those things, we were able to put a referral into a platform where other community-based organizations live, and they get contacted and then connected. And then 2 weeks later, the promotores who they got to meet, who they know, call them back and follow up to make sure that they got to the resource that was found to be necessary for them to live a long and healthy life. I think those kinds of programs are needed to build trust. For the question in the audience that asked about what do we do with communities who don't have devices, who don't know how to use, or who don't have internet access, or don't know how to use it, you call it the Digital Compañero program, all right? And so we're just wrapping up our pilot, but what we did was we went to Kern County, San Bernardino County, and for Latinos who didn't have access to the internet, didn't have internet access, they didn't have a computer or a device, they were provided with internet access via hotspot, or the free internet program through the government, the ACP program. If you haven't heard of it, everyone should be knowing about this. If you qualify for Medicaid, you qualify for free internet. And then we now put them into a 6-week program where they learn digital skills. And then that way they're able to navigate the World Wide Web, because until you can navigate it, you're like a sitting duck for misinformation, disinformation, right? Because you get your news through memes. But once you have that knowledge, once you have that access, then you can navigate to trusted websites like CDC to find out how best to combat COVID-19 in different situations. Those are some of the things that I would say are important that we need to scale, and just make sure that the community is based in the center of that design, so that it's reflected in its outcomes.
Perfect. Thank you so much. Yeah, a lot of feedback from the audience. And I love that you took a leap right into the Q&A from the audience. So I believe Desenia Carrillo, I hope your question was answered. And just also so everyone in the audience knows, I am keeping track of the questions. And if we don't have time to get to it today, I'm going to actually message these questions out to our panelists, get responses from them, and also send these answers like literally back out so that, people have all the information they need possible. That's my dog in the background. Sorry you're hearing that. But yeah, so let's just dive into the next question from the audience really quickly. There's a couple people, public health degrees and just trying to, let me see if you're coming from a different industry with design to get into health tech. So what do you suggest as a starting point into breaking into tech in general? Let's go with Marisa.
Yeah, I love this question. So I I have a degree in public health, and I never got the degree thinking I was going to break into tech. That is something that has evolved over time, and I'm certainly really excited about it. But I think we're in a time that is so unique for healthcare because we have a regulatory environment, we have a tech environment, we have the delivery environment, and we have a pandemic that we had a lot of learnings from, a lot of mistakes, and certainly a lot of preparation to make sure that a lot of those mistakes are not repeated. And so there is a huge need for innovators and people who want to break the mold of what's been done and to try something new. And, it's going to take people who think big. It's going to take people who are not afraid of risk and challenges, and very honestly, for failure. We got to try, and we got to try different things because what's been done in the past isn't working anymore. And so the health tech world is open to thinkers, and it's open to people who are not afraid to use their platforms like this one to raise flags when things are not going right or when things need to be done differently. And so I would encourage people to, follow up the panelists here. Of course, use the Techeria community to start asking those questions about healthcare and how you break in, because there's so much room for improvement on the policy side, on the tech side, on the delivery side. And we need people like everyone in the group here to start to push those boundaries on the status quo. And so we see people that do really well in health tech that didn't come from health tech backgrounds because they came from lived experiences and because they came from a place of passion and they came from a vision that they want to change something and they're not afraid to really challenge that status quo. So I would just encourage everyone who has that interest in whatever your background is to start to just share your story and share your passion with the people here, and as you network across the community, and you'll start to find people who want to use that passion, want to use that vision to help grow what they're working on and what could be like the next great healthcare innovation.
I agree. Yeah. Also, don't be shy. Put yourself out there. That's what it's here for at the end of the day, right? I'm not in health tech. I'm just, in the nonprofit world for tech, but I had no tech experience prior. And I was working in law firms and on booze cruises. And sometimes you just got to go for it. Even if you don't know too much about it, putting your best foot forward and just going for it can take you a long way. So don't be shy to connect with our panelists as well. The last question, because we do have 3 more minutes. There's people that want to know what they can do within the community to be advocates. How do we do that? Where do we start? So we can pass this. Honestly, anyone can take it. Whoever wants to jump in on that, by all means, please go. Jill.
My answer is going to be...
Okay, Luz. Go ahead, Luz. Sorry.
No, my answer is very short. Let's get involved. That's what we need. I think that's what we need to do. Let's get involved. Let's continue to do advocacy. Let's continue to get connected with our people. Let's continue to advocate for what is best for us, our culture, by doing what we're doing, by taking advantage of every opportunity that we have to engage in things like this to raise awareness. That's my short answer.
I appreciate that. Also, if anyone on the panel has volunteer opportunities, internship opportunities, or just different opportunities that they are well aware of, please like send them to me so I can share with the rest of our community. I feel like that's also a great way to get into it and learn how to address it. Jill, did you want to answer the question too?
Yeah. I think it also starts with ourselves. I don't do a good job accessing healthcare myself out of, I don't know, irresponsible. And I know I'm in the industry and I know that I should access all these services on a yearly basis. But I do a bad job at that myself as well because I want it easy. I want it as easy as going to Amazon and buying things that I forget I buy. So it starts with us. Go and access the services and talk to people about your experience. And if you find a problem, try to solve it and be part of the solution as well. So and if you want advice on how to transition to tech or any other role, just hit me up in LinkedIn. I have so much to talk about that. I can have a whole panel just on transitioning careers into technology.
Amazing. So we are at time, and I don't want this to like cut our conversation of the platform because I get very nervous. But I wanted to give a big thanks to all of our panelists that participated today. It has meant more than you can imagine to myself, I'm sure to our audience. There's been a lot that has resonated or just new education learned. And yeah, there's been some other questions. Like I said, I will definitely be forwarding the rest of the questions to our panelists. And if you have any other questions, please feel free to put them in now and I will definitely send them and get everyone the answers that they'd like. But yeah, thank you everyone so much. I appreciate you all. Now, live on the stage, we're gonna have our homegirl from last year, DJ Sizzle. She's gonna play an amazing mix. This is your soothing downtime, so go eat or go get water, do whatever while listening to our girl DJ Sizzle on the set. There's gonna be on the main stage and she's live now. So I will talk to everyone soon and I hope everyone has an amazing day. And again, thank you so much to all the panelists. Mwah, I appreciate you all.
Thank you.
Bye. Thank you.
Cuídense.
Thank you.